Hi, good evening, namaskar. It's firstly, before I can, I hope, I wished Dr. Bhushan was there and we could have had a kind of a 360 degree because I represent the patients. So I would have also been able to share some of our anxieties. You all got an opportunity, very good. First, I wish to thank Dr. Ratna Devi and Dr. K.K. Kalra, who were my jury members, for assisting in terms of whoever would get recognized and rewarded today in the evening. You will come to know, and how they stand out amongst all of you all who are in the healthcare delivery business. So the only thing I would like to appeal to all of you is that more applications should come in, and many more people should compete with each other to understand where they are in terms of this contest or in terms of how people rate them in the parameters which Express Pharma has done. So thanks to Express Pharma for giving us this opportunity. I only want to share with you all, and because from the afternoon, from the time of the inauguration, a lot of discussions have happened in terms of the role of the government. You see, I must confess that if the private sector was not there, the healthcare delivery system in India would have been in a worse condition than we could have ever thought of. So the patients definitely recognize that, and my friends who are participating, some of them explained also the various types of people who have come into the healthcare delivery system, and government, as we all know, the data has shown that they are not even 20% of the total healthcare business which is there in the country. So 80% is in the private sector. Now, how do you incentivize the private sector? And why Ayushman Bharat came in, I want to give you some information in terms of how we as patients work towards that. You see, everybody wants universal health coverage. And it's a phenomenon where even the world has come together and signed, and India is one of the signatories. And in 2014, when the manifestos were being made, we reached out to all the political parties in terms of universal health coverage. And BJP was one of the political parties who agreed to put it in their manifesto. And because they had put it in their manifesto, they were fairly bound in terms of going ahead with universal health coverage. And fortunately for us, in their 4th year, they announced the Ayushman Bharat as the beginning. So it's a beginning. What I want to tell the private sector, and of course Dr. Bhushan has also said that, the prime motive is quality health care for all. You see, the cost comes, it's a very relative term, it comes later on. But what is most important and which cuts across all the various kinds of delivery system which is existing in our country, or the entities which are existing in our country, the parameter is quality. And we don't have a law as such, let me tell you, in the healthcare delivery system in our country as of today. Being a state subject, it has not come in yet, and we have been wanting that there should be some kind of a regulation in terms of standard. But there has been a voluntary standard led by Quality Council of India, where I happen to sit in their board in the last 2 years. And what I have found is the National Accreditation Board for Hospitals and Service Providers have brought in some kind of a standard which certain hospitals have agreed to get themselves accredited or certified. But the numbers are very few, let me tell you. Those numbers are definitely not encouraging. And when I speak to any of the hospitals which are not accredited or certified by NABH, the only answer I get is, what is the benefit I'm going to get by getting myself accredited or certified? Friends, let me tell you, you are in a business where standard is paramount. Safety of patients is paramount. You can't compromise. And the benefit you would get is you would be able to empower the citizens and make them understand that how to differentiate between an organization which is not only patient-centric but is also quality-centric. And hospitals which don't stand out, and fortunately for you all, till now, Quality Council has not been able to do a mega campaign like we did for Jagograd Jago, where people have been able to come in a big way in terms of empowerment. In the healthcare business, we have not been able to bring that choice. Choice is going to be the fundamental cornerstone for healthcare delivery system in the coming years, let me tell you that. And what we always been wanting as patients is it has to be an informed choice. And it's going to be a business where we would come out with data. You know, like I observed in US when I visited for the first time, they come out with a magazine called Know Your Neighborhood Doctor. And what does that magazine say? That magazine only says about your neighborhood doctor is how many people have gone and complained against the doctor to the regulator or taken them to the litigation. Our fundamental story is that how do you all make yourself accountable to the patients to make sure that all that cost which you are asking for, which the patients are paying you with a smiling face, how do you make yourself accountable and transparent in terms of quality? Until you don't do that, I don't think we're going to move to that level where we are talking about universal health coverage. And there is going to be, if not in the next 5 years, but maybe by 2030, we should be able to see that in India, patients are empowered to such an extent that they're going to make a choice. They're going to decide which hospital they're going to go for which treatment. And that is how the prices will get fixed and decided, because that is where we will drive through. And this is where we are telling the government that it's now 2.25, as they have said, that they are going to spend on the GDP on healthcare. We want to take it up at least to 5 to 10%. And we're going to work on it. The patients are going to work on it. And that money is going to actually trigger the change, because that money is going to go to the private sector. And what I've always told my private sector friends is that you have always claimed to us that you look after the poor. You have always told us that we do a lot of free treatment. At least most of them have confessed that 5 to 10% they do free. And what I have told them is Ayushman Bharat is nothing, but now government has agreed to pay you for them rather than doing it free. You're going to get paid for it. So I would also appeal to all of you today in the evening that please join the campaign, please join the movement. Let's understand how much loss you're going to incur. Let's understand where you're going to have the losses out of and how it is going to happen. Because it's your decision. That to what extent today you are not connected. Many of you are not connected. 8,000 is nothing in our country. If 8,000 are empaneled. And as you know that we have been able to convince the government that people who are NABH accredited will get a 15% extra incentive in terms of the package and 10% for the entry-level people. We would go ahead to increase it further, provided the private sector joins in. And this is where we as patients are going to play a role on behalf of you people. You know, like many of you said, yes, what incentives, what tax breaks? Well, Dr. Bhushan may not be able to speak up, but we can speak up. That's our advantage. We would speak up, provided you all join and you all show your commitment that yes, you are seriously interested in this business and you want to go to the next level. So friends, with this, I would like to congratulate all of you who have participated in the award competition. And I also want to especially congratulate the winners. And I thank each one of you, for doing such a huge private sector engagement in the health sector in our country that we are so proud of you all. We as patients, we are definitely very proud of the contribution you people are making, but we want to see much more. We want to see much more, and we want to see that how this partnership can go, where all the people who are involved in the healthcare delivery system, including your employees, your staff, all the support systems, we all come together to get to a mission where we are talking about universal health coverage at the most affordable cost without compromising on the quality. Thank you very much.